Mr. Chairman, thank you very much, and thank you for holding this hearing on an enormously important subject. But let me begin by kind of disagreeing with you. If one's goal is to provide quality health care to all Americans in a cost-effective way, clearly the current health care system is broken, it is dysfunctional, and it's cruel, and it's failing. I don't think anyone denies that. But that is not the function of the current health care system. The function of the current health care system is to make huge profits for the drug companies and the insurance companies. It is succeeding. We have a very successful health care system. Last year, the drug companies, who charge us the highest prices in the world for their products, made $100 billion of profits. That's successful. What's the problem? The insurance companies, who deny health care every day to millions of Americans, they made $70 billion. What's the problem? You got a successful system. Drug companies are running all over this place with their lobbyists. Insurance companies here. It is working. On the other hand, if you're an ordinary American, as you indicate, Mr. Chairman, the system is totally broken and it is dysfunctional. And while I'm sure that we have an excellent panel today, at some point, Mr. Chairman, if we are serious about addressing this issue, we have to ask a simple question. How is it that in the United States of America, where we are spending the astronomical and insane $14,500 per person for health care, and yet we got 85 million uninsured, how come other countries around the world are able to provide quality care to all people, often at less than half the cost per person? That's the question that we should be asking. And the answer, obviously, is that every other country has a national health care program. Every other country understands that health care is a human right, not a commodity to be made huge profits off of. Further, Mr. Chairman, I do find it a bit ironic that we're holding this hearing this morning just a few weeks after President Trump signed the largest cut to Medicaid in the history of our country. The CBO has estimated that this bill, along with the expiration of the enhanced premium tax credits, will cause over 15 million people to lose the health insurance they have. The bill, for the first time, talk about making health care more expensive, forces millions of Medicaid recipients who make as little as $16,000 a year to pay a $35 copayment when they need to go to a doctor, and allows hospitals to turn patients away if they can't pay that amount. As a result of these policies, my friends and the American people, the Kaiser Family Foundation has estimated that health care premiums will go up by more than 75% on average for some 20 million Americans. Not exactly a way to lower health care costs in America. Further, the Urban Institute recently estimated that these policies will increase health insurance premiums by nearly $3,000 a year for working-class Americans who earn $60,000 a year. George Washington University has found that this bill will cause more than 10 million Americans to lose the primary health care they currently receive at community health centers. When millions of Americans lose access to primary health care, where do they go? Well, everybody knows. They go to an emergency room, which happens to be the most expensive form of primary health care in America. I don't think we disagree on that. So, Mr. Chairman, if we are serious about making health care more affordable, I believe a good place to start would be to repeal all of the huge cuts to health care that were contained in Trump's budget bill that passed the Senate by one vote. But, Mr. Chairman, in my view, we got to do much more than that. In America today, we spend almost twice as much on health care per capita than nearly any other country on earth. We spend $14,570, Japan $5,640, United Kingdom $6,931, and France $7,100. Despite our huge health care expenditures, one might think if you spent that much, my God, we got the gold plate. We got the best healthcare system in the world because we're spending twice as much. We don't. Our healthcare outcomes in area after area are worse. unbelievable. I mean, this is, you mentioned some of the instances that middle class and working class families have, and you're quite right. But this is the system we have today. 42% of cancer patients in our country, Mr. Chairman, deplete their entire life savings within the first 2 years of their diagnosis, while 1 out of every 4 declared bankruptcy or lost their homes to foreclosure or eviction in 2022. In other words, unbelievable. If you're diagnosed with cancer, the physician, I'm sure you're aware, it's a terrible diagnosis. You're scared to death. And now people have got to worry not only about trying to get healthy, they're going to lose their homes, they're going to go bankrupt because of this absurd system. Mr. Chairman, this is, you indicate correctly, this is also a burden on small businesses. Businesses can't invest if they're spending so much on health care. The reason I say all these things is that the current system is broken. We need to move to a new system. We need to learn from the rest of the world. And that's why I recently introduced Medicare for All with 15 co-sponsors in the Senate and over 100 in the House. This legislation would provide comprehensive health care coverage to all without out-of-pocket expenses. And unlike the current system, it would provide full freedom of choice regarding health care providers. No more networks, etc. No more insurance premiums, no more deductibles, no more co-payments, no more filling out endless forms and fighting with insurance companies. Would a Medicare for All system be expensive? Yes, it would. But while providing comprehensive health care for all, it would be significantly less expensive than our current dysfunctional system because it would eliminate an enormous amount of the bureaucracy, profiteering, administrative costs, and misplaced priorities inherent in our current for-profit system. The director of the CBO, who I should point out was appointed by the Republican leadership in Congress, estimated that the Medicare for All bill that I introduced would save the American people $650 billion a year. That's real money. $650 billion a year. You want to save money? Cost of this, how do we lower the cost of health care? $650 billion is a big reduction in cost. In addition, the Rand Corporation found that moving to a Medicare for All system would save a family making less than $185,000, about $3,000 a year. Also, let's be clear, because this is exactly what the American people want. According to a poll that came out just this month from The Economist, 59% of the American people, including 67% of moderates and 57% of independents, support Medicare for All. So why don't we have Medicare for All? Well, that touches on another issue, Mr. Chairman, and that is a broken and corrupt campaign finance system which prevents the United States Congress from representing the people of our country rather than the insurance companies or the drug companies. And with that, I yield.